Hello, my name is Joyce Webb, and I'm a project director in the Joint Commission's Division of Healthcare Quality Evaluation. This presentation will provide you an overview of the Joint Commission's Sentinel Event Alert number 47, Radiation Risk in Diagnostic Imaging. On slide 2, you have your objectives. At the end of this presentation, participants will be able to demonstrate an understanding of the Joint Commission's Sentinel Event Alerts and how they should be used in the organizations to address safety issues, and number 2, to identify actions that can reduce avoidable radiation exposure. With that, we'll move to slide 3. And first of all, I'd like to provide you some background regarding the Joint Commission's Sentinel Event Alerts. It's a complimentary publication of the Joint Commission, published for Joint Commission accredited organizations and other interested healthcare professionals. And these Sentinel Event Alerts identify specific types of safety events and describe their common underlying causes and steps that organizations can take to prevent occurrences in the future. And they're developed by a patient safety advisory group. Slide 4 provides you some information regarding the composition of the Patient Safety Advisory Group, and you'll note that it includes representatives from a wide range of experts in the field, representatives with hands-on experience in addressing patient safety issues in a wide variety of healthcare settings. In slide 5, the Sentinel Event Alert, the ways to use these alerts. Accredited organizations should first of all be sure to route the Sentinel Event Alert to the appropriate staff within their organization and take into consideration the information provided when designing or redesigning related processes. These are suggestions, they are recommendations, but the information contained in the alert or reasonable alternatives should be considered for the organization's processes and policies and procedures. On slide 6, you'll note that really there's been a lot of research on the use and effects of radiation exposure. Studies have shown that the higher the dose of radiation delivered at any one time, the greater risk for long-term damage. Studies about the cumulative effect of multiple repeated radiation doses over time. And also, on the other hand, how inefficient radiation can result in misdiagnoses and delayed treatments, as well as studies related to the risks of radiation exposure, such as the development of cancer and burns. On slide 7, there's an explanation about why radiation exposure is such a significant concern, and you'll note that exposure to ionizing radiation has significantly increased. And one study estimated the potential for 29,000 future cancers and over 14,000 future deaths due to radiation exposures. So it's a really significant problem there. On slide 8, because of the information I provided you on slide 7, it is really important to consider the risks versus the benefits of diagnostic imaging by looking at ways organizations can maintain radiation doses that are as low as reasonably achievable, and many of you will recognize the use of the ALARA concept. Organizations also need to weigh the medical necessity of a given level of radiation exposure against the risks and implement steps to eliminate avoidable exposure to radiation. This is for patient and for staff. And the diagnostic procedures most commonly associated with avoidable radiation doses are CT, nuclear med, and fluoroscopy. On slide 9, we now begin to talk about the Sentinel Event Alert number 47, which focuses on radiation risks of diagnostic imaging. As you'll see from slide 9, it was published in 2011 and really focuses on diagnostic radiation and those factors contributing to avoidable radiation dosing and actions that organizations can take to eliminate avoidable radiation. Recommendations included in the Sentinel Event Alert, suggested by the Joint Commission, are on slide 10. And it's really important, first of all, to make sure that organizations are taking steps to raise awareness among staff and patients by ensuring that they're providing the right tests, the right radiation dose, having effective processes in place, ensuring that the technology that they use are safe, and ensuring that a culture of safety exists throughout the organization. First of all, let's talk about the right test. It's really important that organizations consider the use of other imaging modalities that do not use ionizing radiation, such as an ultrasound or MRI, and implement the use of the American College of Radiology's appropriateness criteria. In ensuring that organizations are providing the right dose, it's important to implement guidelines that align with ALARA, as I mentioned before. And this means providing radiation doses that are as low as reasonably achievable. Also, complying with and implementing those campaigns such as Image Gently and Image Wisely, and providing reference dose guidelines and establishing dose ranges for those high volume, high dose types of studies. Slide 13, also, to ensure the right dose is provided, there should be regular review of dosing protocols to ensure that they adhere to the latest evidence. Organizations should investigate radiation dose patterns that fall outside the range of appropriate doses and record and track radiation doses and exposures and take a look at those exams that were repeated to try to understand why that happened. Slide 14 moves to effective processes, and this is about the organization's policies and procedures. Implementing processes that address how and by whom changes can be made to imaging protocols. Policies that address patient and staff radiation exposure and procedures in place to minimize that, providing education for technologists. And these policies should address the use of a medical physicist when designing or altering scan protocols, and ensuring that there is oversight in place of these related policies and procedures. Slide 15 provides more information for organization and more guidance about establishing effective processes, making sure that there is a multidisciplinary group in place providing some oversight, and that group should include a medical physicist, ensuring that all physician and technologists who prescribe and provide diagnostic radiation or operate that equipment receive education and are sufficiently trained on the procedures, and a process for ongoing annual education review and competency testing. Safe technology is another one of those recommendations, and safe technology means ensuring that the equipment that's in use is really operating appropriately. We recommend that organizations monitor equipment performance and establish processes to ensure that testing and quality control is conducted in accordance with the manufacturer's guidelines. Safe technology on slide 17, ensuring, as I mentioned, that the appropriate quality control, the testing, particularly for new equipment that's put into operation. Those daily functional tests are performed, preventive maintenance activities, and also organizations should invest in technologies that optimize or reduce radiation dose. A safety culture is really important to organizations providing diagnostic radiology. And safety culture, this recommendation is about having organizations establish a culture that supports and promotes a safety culture that will help ensure that staff feel comfortable speaking up whenever they become aware of issues that may lead to radiation overexposure without concern about retaliation. For more information about safety culture, that is available on the Joint Commission's website. In addition to the recommendations I provided you, the Joint Commission also endorses the creation of a national registry to identify optimal and reference radiation doses, encourages imaging equipment manufacturers to incorporate dose safeguards and methods to capture radiation dose information, and the Joint Commission also supports stricter regulations designed to eliminate avoidable imaging and to monitor the appropriateness of self-referred imaging studies. To view the entire text of the Sentinel Event Alert number 47, Radiation Risk of Diagnostic Imaging, and other Joint Commission Sentinel Event Alerts, visit our website, and you have it listed there for you on slide 20. This concludes my presentation on radiation risk of diagnostic imaging. I provided you an overview of the Joint Commission's Sentinel Event Alert number 47, and now we'll move to the question and answer portion of our presentation. Thank you.